To the April 6th, today is the 6th, Thursday the 6th, policy meeting. And we have a few items on the agenda. The first item is policy for first reading, and it's 516.5 overdose medication policy. And this is, again, a new policy, model policy from Minnesota School Board Association and the Minnesota Association of Superintendents as well. And I'm going to turn it over for just some background to Assistant Superintendent Anthony Bonds.
And because of time, I'm going to quickly turn it over to Laura, who is our Assistant Director for Special Education, Laura Thurston, as well as Crystal Holker, who is in a new role, and the official title is?
Health Service Coordinator.
And their Health Services Coordinator. So this is a policy that has been worked on by the both of them. This is one of those policies that is definitely very timely in nature, given the number of incidents of overdoses that are happening in our county, and we think it's very important and prudent as a school district that we make sure that we have a policy and procedures in place. And I'm pleased to say that they've been working on this policy, and they're going to give some insights to it.
Thank you both for being here and spending time with us. I don't know if you'd like us to go around really quick, or just, do you want to just introduce yourself?
Sure. I'm School Board Member Sadowski.
And School Board Member Sandholm.
John Megas, Superintendent.
Yep, so we're looking at getting Narcan and naloxone in our schools. We'd like to have it each site for the event of a opioid overdose. We looked into different community resources to help secure the medication. We have worked with the organizations to line up training for our staff who will be trained to administer it in the event that someone need it. As far as for the storage location within the school day, that those who are trained have access to the medication in the event of need.
And I would like to add that this is a MSBA model policy that has been recently adopted as of within the last month or year. So just wanted to acknowledge that. Or did you have any additional information?
I do not. Like Mr. Bond said, we're just bringing it forward for its first reading. Crystal's done the work on it. We're going to read it with Jason. Jason's enjoying so much needed rejuvenation. So I'm here in this place.
In the model policy we have, there were some areas that were struck out in terms of school district activities outside the school site. Can you just kind of talk about that a little bit?
Just to let you know, one of the things that we do when it comes to all of our policies, we're trying to make sure that we ensure there's systematic communication that occurs. So the policy has been reviewed by our administrators and other district leaders as well to provide feedback on the individual administrator who's going to be bringing it forward for reading. So I wanted to let you and the community know that we really go through a thorough vetting process of ensuring all of the key stakeholders have input into the policy. On section 1, purpose, what we'll scratch off is after school or at school district activities. One of the things that we want to ensure is that because it's really hard to manage and properly manage the storage of Narcan properly, that right now the goal is to make sure that it's all available during the actual school day when we know the trained individuals will have access to the Narcan, which at this point in time, we're going to be determining like where it's going to be stored. It's going to be in the main office, it's going to be located in the nurse's office. Those are the kinds of things that we have to make some determinations on.
Yeah, so the thought is it would be stored somewhere that anyone who is trained would have access to, but we also want to make sure it's in a secure location so it's not tampered with, stolen, and not there when we would need it. And so that's why we put it for the school day, so it is in a secure location.
Will there be like a certain number of people per building that will be trained? I mean, is that kind of the thinking?
Yeah, so we'll work with each site, both the licensed school nurse and the building administrator, and talk to them about who is involved in their emergency response team.
Okay.
And that would be our first, set of staff members we want to train.
Question,
Yeah,
Paul?
well, I guess I have a question and a concern about that too. When it comes to after school activities, I mean, I would think the likelihood of a problem could be just as high, after school sporting events and or other activities. If the activity directors could be included in this, at least they have access to where it's going to be stored. And maybe that they need training too, and or somebody else that's going to be an administrative person or whoever else would be present for after school activities would know what to do to deal with that. Because again, you're going to have, additional people there that aren't just students, where you could have, again, an issue.
But you're agreed. One of the individuals we thought about in our conversations, making sure the custodians are properly trained with the usage, because they're there most often throughout the school day, before school, after school. They may come across community members or others who are in our building for a variety of reasons. So as a district, we want to make sure we make determinations on who should receive that training, and so that we are thinking about access in the evening. One of the things that we didn't talk about, and we haven't explored this yet, how do other places store it properly? So if it is going to be accessible, is there a way, and maybe others have figured this out, maybe similar to the AED machines that are accessible and they're in the halls, have companies also have Narcan, similar to the AEDs, in a secure storage unit that has an alarm on it, or that has some kind of safety feature on it. So those are things that we could explore as well, but to be honest, we have not gone down that path of how we're going to make it accessible beyond the school nurse's office and the main office.
I shared Member Sanholm's concern about not having it at after-school activities, because I agree. I think that the likelihood of something like this happening is probably even more after school when there's less supervision. I think this is a really good start, and we'll think about how we can implement it well and make it very thought out. I think it's maybe just my experience with Narcan and in my line of work. Like I just think it should be on very accessible, every floor. You shouldn't have to be running down to the main office to get something like this when you are in a situation where you might need it. So, but you have to start somewhere. So.
Yeah, and I would imagine, again, we haven't done, at least I haven't, are you aware of other organizations or businesses and how they store Narcan?
Some districts have it similar to what's presented here with just during the school day. It's in the school health office. Others do have it in their AED box. So it's really a district decision on how it wants to be stored.
Is this something that would be a target for being stolen?
Potentially, yeah.
So I mean, the thought to where it's stored needs to be thorough, and we need to be sure we're taking all those appropriate things into consideration. I had another question, but go ahead. No, I lost my train.
So just to clarify, and then Superintendent Magus, by kind of striking out the at-school district activities after school, is just as we're developing this policy, we want to make sure we can cover the school day first, and as we in the future we can expand it, but we want a thoughtful process that allows us to do what we we feel we can do now, right? Which makes sense. We don't want to promise something we can't do, and we have a lot of buildings in our district, which is different than many other districts, so Superintendent Megas.
Similarly, I was just going to say that I appreciate the work that's being done on this. I know it's emerging quickly, and in conversation with other districts and other superintendents, people who were concerned about it and opposed to it a few months ago are now on board and seeing the utility of it, and also that I think one of the things that is really important to know is that by administering Narcan, you can't cause harm to somebody by misadministering Narcan. So if something is not an overdose and you administer it, it's not going to have a negative effect on somebody. So that I think brings a level of to some degree, peace of mind for people. And I like the idea that we're rolling this out within the scope of what we're capable of, but also with an eye to revising it within maybe even next year, or maybe even during the year if we find that we're able to find ways of doing it during the after-school events. I would like to see it as available as possible, because I think we've already had it administered in a number of school districts in Minnesota on students, and it's saved lives. So it's only a matter of time before we're going to need it and benefit from it. So I'm glad we're moving in this direction. If we can keep an eye on it, we'd be grateful.
Does it have a shelf life and or storage requirements, temperature-wise, or anything like that?
So there is the typical expiration is 2 years. And then as far as storage, room temperature.
Room temperature is okay?
Yeah. Yeah, so I did work with the Rural AIDS Action Network to secure if we proceed. The order does require a medical provider signature. They're willing to get that signature for us. It's been paid the medication on our behalf. There is a cost to it. Narcan is supplied, or naloxone is supplied through 2 different routes, either the nasal, which is common in the community, or via injection. Looking at cost, they approximately for the nasal, it's $42 for a 2-dose kit. The shot is $15 for a 2-dose kit. For ease of administration, I recommend the nasal route, and that's what those districts are.
And that also speaks to the standing order. So if we go on to the next area where there's a strikeout, I'd say it is it's under definitions, standing order. It says means directions from the medical provider, stricken out school officials.
Yeah, so we would use a community resource.
Oh, okay. Did you want to go further down with what was any?
4.2.
So on 4.2, strikeout is
Again, that is just speaking to, it says, in all district facilities and activities, we would have it at our school sites, and not at activities at these times. And then under the storage piece, the strikeout of numerous locations, and they have to look at cost and accessibility, how many locations you would have within each site. So we want to promise numerous, right, if we're only doing.
Well, would it make more sense to have, numerous 2, 3 in high school, middle schools, but maybe just one location in elementary schools? Does that make sense, or I don't know?
So it is something we can look at, again, as we look at where we're going to store it.
But across the state, and Superintendent Magus referred to it just a few minutes ago, there have been incidents, so are those mostly at high school?
I think that they've had some at a variety of levels, but it's probably more, the older the students, the more likely it is. But there have been some elementary situations too.
Is there a plan to educate all of the teachers about who would be the point person for this? So they would know where to go and who to call?
Yes, we would. We would make it very similar to informing them regarding where everything are identified, as well as our EEPs. It will become something that will standardize in our communication of first aid.
On the same vein of that, how about educating parents on, there would be a process for educating parents once this policy.
Yes, and we don't do that often with all policies, but this is one that we would probably want to make sure that our family receives some additional communication, some straightforward communication, direct communication. We can ensure that that happens.
Would it be something that would go in our handbook?
We are actually scaling back the number of things that are in our handbook. I'm looking at Mrs. Lara because she's one of the individuals who has been working diligently
Have to take a lead on that one.
on making our handbook a little smaller. So the answer is yes, it might, but
So I'll just talk real briefly, just if this is preliminary work that you're gonna be seeing a lot of me in the next few months. We are taking a look at our current family and student handbook, and right now we're taking what's in that and putting it into the MSBA handbook format. So when we were doing a review of our current handbook, we're like, how do we know if we're really lining up what we need to have in our handbook according to statute and according to policy? It's not really indicated in there anyway, but MSBA does have a model handbook, and it does indicate for us what is absolutely required in our handbook. So we are taking our information and embedding it into a new handbook structure. And so if that is one that is indicated with a star, it'll definitely be in there, but I don't know off the top of my head if it is or not yet. So.
Thank you. Any other questions on this first reading of 516.5, the overdose medication? Also want to remind folks that at the end of this policy, it has all the legal references, the cross references, again with NSBA, the Minnesota Department of Health Toolkit on the administration. So a lot of background for further reading between now and our board meeting and or our second reading. Any other questions though for Crystal or for Laura? Yeah, just thank you again. I know a lot of work again goes into these policies, and particularly this one before coming to us, and we just really appreciate that a lot. So thank you. Okay. Okay. So policies for second reading, we do not have any second readings. Policies for review. Policy 513, student promotion, retention, and program design. I'll let Assistant Superintendent speak on this, but there are not going to be any changes, so we can review it and then we can move forward because we're not going to make any changes. So.
Thank you. And for the sake of time, I'll turn it to Director Laura.
Yeah, thank you. So really we wanted to come here today to address 513R, the regulation, and part of our process that we are going to be moving forward is that when we are reviewing like regulations and bringing regulations to you, that we're going to be reviewing at the same time the accompanying policy. And so there are no changes from the MSBA policy. This one was one that was adopted back in 2018. But it has been 5 years, and since we want to come back to you with the regulation, we just wanted to just update and revise at this time. And it has been reviewed. There are no changes.
So it was revised in 2018, April of 2018. So. Any questions on that before we move into then the regulations, which again is informational. We don't vote on the regulation. It's more for our background information to back up the policy.
So
That's the regulation.
That's okay.
Yeah.
We don't vote on the regulation. That's more informational to follow the policy. So do you want to speak towards that?
Yep, I can certainly speak to that. So we're here today to really talk about the regulation more, and yep, again, it is informational for you. We had a change to our regulation back just before COVID. So I think it was adopted like 2019, just before COVID hit. We had paused the regulation as we did many of our policies during COVID, just because it was really hard for us to accelerate students when we were in such a different kind of a learning environment that couple of years. So this is Kaylee Pelkey. I want to introduce her to you all. She is one of our East Square teachers. She's also our acceleration specialist for the district. So Kaylee and I have been working together for 3 years now on the processes that we're using in order for acceleration of students that are wishing to be placed in a grade above them or even in a subject acceleration. And we have found that there are just a lot of things in there that weren't articulated very well. One of the things that we found were like, we don't have any deadlines, like you need to apply by April 1st to be considered. You know, those kinds of things get in our way throughout how we function throughout the rest of the year. And so for the past 2.5, 3 years, we've been really talking a lot about the acceleration policy, and she's been working pieces through with it and finding out what are some of the things that could use some attention when we talk about it in our regulation. So we now feel that we've worked through a lot of kinks, and you're going to get a handout from Kaylee kind of explaining our process to you as well. She's really walked through this really well with counselors. So we've met with counselors, we've met with principals, we've met with TLE, so other people are all aware of, and we've gotten input from them as well into how we do this. There are certain schools that accelerate more students than others in our district, and so we want to make sure that when we are looking at our regulation as well, that this is being looked at through an equity lens, because we want to ensure that you know, students that may not have as many resources available to them, that the policy can be used and support them, as well as maybe a student that might have the means to do something a little bit different. So I'll leave it at that, and I'm going to turn it over to you to talk a little bit more about what we've done here.
Yeah, so like she said, we added a deadline, April 1st. We also realized that we didn't have criteria for our single subject accelerations, and that was a problem when we got into these meetings, and like teams didn't really have any guidance to go on to like make those decisions. And so we kind of took what we had from the whole grade and like adapted that to like single subject, so it's sort of consistent. So there's now criteria for those teams to make decisions on. Also, made a flow chart.
So what we have in front of us is the current policy, then in the yellow and red is the revised regulations, and are you gonna walk us through the revisions with this corresponding? Okay.
So everything that we revised in the policy is kind of reflected into this flow chart. So it's referenced in there too, like please refer to this flow chart, and this just kind of makes it easy for like staff and families, and just kind of lays it out there. So the first part is like page 1 is like the procedure for the whole grade acceleration requests for kindergarten and first grade. So that kind of is, the request comes in before April 1st. If the student's new to our district, we ask that it be in before September 1st. And that just gives us enough time to like run through this process for them. So the first thing is I'm going to be contacting the family, letting them know we got the request. And then I'm sending off that request to the building principal and the school counselor. So everyone's kind of aware this request came in. So then you'll kind of see The first page is the whole grade K1. Page 2 is whole grade 2-4. So there's just different processes with different like assessments that have to happen. So that's why there's 4 charts. The third page is single subject for K4, and then the back is single subject for 5-12. So just kind of like run through what that looks like. I'll just run through for single subject K4. So the first thing we're going to look at is their current data, and if the student, and I'm using the example of math because most of the requests that come in are math. So if the student, their math score is at the 99th percentile, either nationally or district, then we would move forward with further testing. If it's not, then that process is going to end. And so the reason for that is a couple things. One is this is like a very timely process. They take about 10 hours of different people's times at minimum. And so we've had students request accelerations that are scoring from the 50th percentile all the way up to like the 99th. So the range is a lot. But we found that our students aren't being recommended for acceleration if they're not kind of meeting that top score.
And that was recommendation from Director Dr. Tanya Lake as well, because she was looking at the data from Bassbridge, and it helped you analyze that too.
Yeah.
So this was in conjunction with our assessment director.
Yeah, so then if we're gonna move forward, then other data is collected, and then further testing is scheduled, and that testing comes, and then the student would complete the test. And then I don't grade that test, I send that to the math content specialist, and they will grade it. And they've kind of like set these guidelines then of what they feel comfortable like recommending a student to accelerate. So these guidelines are coming from our math department. So for elementary, it's 90%, and then for secondary, 88%. And then the last step is like a team of 8 and like make a plan for that student, including like transitions and kind of what that would look like.
So the regulation, I think, really more defines, gives people more guidance into the process. It also defines what the team is. Initially, all the principals thought that she ran everything. She's the acceleration person. She's running all these meetings. And no, actually, it's a site team that's running the meetings. So we're really trying to give some clarity as to who's running the meetings and who's making the decisions. This is kind of like if you took a look at a pyramid for like supports, where we talk about tier 3 as usually ending up being like special education supports. This is more on the gifted end. Her other role as the E-squared person is more that tier 2, like giving those interventions for students that can accelerate, not accelerate, but can handle more rigorous. So she does that, and then this would be that next level, that tier 3 then for students that that I don't want to use the word gifted, but it's funded from gifted and talented out of our Title I fund. So I guess that's probably the easiest way to phrase it. Other things that we needed to clean up were things like transitions. So sometimes you make a request for a student and it doesn't really work out for them. And all that was really stated was, yeah, transition period is recommended. Well, we really wanted to clearly define, like, yep, for 6 weeks we should be watching this kid and making sure that we're keeping tabs on them and having conversations, you know, and making sure that they're transitioning well to this before I make any determinations whether they stay in or come back to their regular grade level. And so there's a little more components in this regulation just that cleaned up how it was being handled. So I don't know if you have any specific questions.
The page at the end, the acceleration request form. So parents fill out this form, they pass it on to the principal. Is that, right?
It does say to the student's principal, but usually they turn it into the building, that's why it says the principal. We do have an online request form that goes directly to Kaylee, and I think you end up getting more of them probably through that way
Yeah.
anyways. So she's getting notification on a Google form, this is just a paper copy of the form.
And so how do parents know to do this request?
Yeah, you wanna talk about how you notify everyone about this?
Yeah, so we have it on our website, about acceleration. We put it in different like newsletters. So Maggie and I, Maggie is the other e-sport teacher, we send out a newsletter to elementary teachers every month, and so we put it in there, like, these are some students who you might want to keep an eye on, that this might be a good fit for them. So we kind of communicated it that way. We stick it in sometimes, like those newsletters that go out to staff. I don't know.
And I think, in the past anyways, when I was at Bowl as a principal, I always go back to that, you know, like, when you have conferences and you're really talking with your families at that time, you know, teachers usually will be like, yeah, you know, they could use more challenge, they might pull in like Kaylee or Maggie, especially at the 3rd, 4th, and 5th grade where they're working with those kids in the E-Squared program. Those might be more conversations that are had at conference time.
Any other questions?
I guess I just have a quick question. Can you hear me okay?
Yeah.
I'll try to speak up, but on the secondary testing, that it drops all the way down to at or above 80% move forward with acceleration. I mean, that just seems, with what we're talking about here, it seems like a low bar. I mean, especially compared to the elementary requirement. I get it.
Yep, so they're scoring at like A math, they're running through the A math, and that's 99 percentile, and that is at their current grade level, okay?
Yes.
So this will be like if they're a 4th grader and they're scoring here, but they want to actually be in 6th grade, right? So for the next year, instead of going to 5th grade math, they want to go into 6th grade math. Or this will be older, whatever, the older kids, but if they wanted to skip a grade, they have to take the test on the content that they have
For the higher
not.
grades?
Yeah, so they're taking the test on the grade level content standards that they have never taken in class. So if they're scoring at an 80%, that's what our content specialists have come to the determination, like if they can get to 80% without ever having been taught any of the content, they're probably good to go on to the next level. So that's why that score is
That's where that number's coming from.
Yeah.
I just kind of wanted to understand that a little bit.
Yeah.
I mean, it still seems like a low bar, but I guess I understand what you're saying. I mean, they're gonna catch up.
Yeah.
They tested at the 98th or 99th percentile on the national standard tests, or
Yep, in their current grade age level band, so yeah.
Thank you.
I was just curious if there's, once in a while you might have a student who just doesn't test well at all, but is there an alternative method for them to, if they're continually doing really well in their work and their teacher thinks, yep, this person really could excel, is there an alternative kind of way to assess if they can move on?
You know, I think we've had a lot of conversations around this. What ends up happening is that, you know, you have kids that you think, yeah, they're doing really well, and there also has to be that level of success in being able to show that they have mastered the content. I think that's just the reality of it. We've got kiddos that we've tested that have not had these achievement scores, that have not then done well. Like, so you've got lots of kids that, like, we have collected that evidence, you know, so we really are looking for these cut scores. And that tells us. And then if they're in this review and having conversation, that's really a team decision that's being made, but they do need that initial cut score in order to start that conversation. So they might not make the 80%, they might be at like a 75, but in conversation with the team, it might be like, yeah, he's really had that day or whatever. They're the ones that making that decision.
or the Einstein Junior pathway.
Yeah, this is for a very select group of kids. This is not the same, even the same group of kids. I mean, the people that are pulled out of our E-Squared program, but E-Squared hits a lot more kids. This is for a very small slice of our population.
Superintendent Magus.
Sure, and I asked this question partly because we've been talking a lot about equity and making sure that we're giving as much access to all students. When I look at the, under the acceleration guidelines and where it talks about the acceleration team now being a site team, and then it went from talking about a whole bunch of people that will be part of the team to people that may be on the team. Just wondering how will we make sure we monitor, or what will this look like in practice, and or should we change the language a little bit to talk about minimum requirements of the team? Because you could technically have a team and just say, okay, it's just a classroom teacher, right? So how, or maybe you couldn't, maybe there's someplace else there. And I'm just wondering how we might allow for flexibility, but maybe where it's not an acceleration team anymore, but strengthen at least who might be the minimum membership of that team, so that you know that it's not just based on
One person.
one or two people's opinion, knowing that sometimes parents lobby hard and that sometimes that affects identification. Your thoughts?
I'm just trying to see if we have identified in here the membership of the site team.
Just went from the acceleration site team was will consist of to may consist of. And so I'm just thinking that we should maybe outline who are the minimum people that should be there. Like I was saying, that the principal needs to be part of it, or the school psychologist, or somebody besides just the, like, we should have some membership defined as a minimum.
And I think the may, I'm remembering some conversations. Sometimes they want to pull in Kaylee, and a lot of times they want to pull Kaylee into all of the acceleration request meetings, but she also is our E-squared teacher, and she can't often attend every single one of those meetings. So I think that there's times when it is important for you to be there, and when we can talk about some of those kind of, like specifics, like why you might be there versus other times that you might not. But I think that might be the may, but at the minimum, maybe we should just say at the minimum, the building principal, the classroom teacher. Some schools have counselors, some schools don't. Some schools have school social workers that are general ed that could be there, and some schools don't. So that's kind of why we had some of those pieces like that. But we sure would want the school psychologist to be there. So I mean, we could be a little bit more stronger if you want us to in that language of like these must
will
be.
consist of blank blank blank
At minimum.
and may consist
Yeah, we
of
could do that.
blank blank.
Yep, we could do that.
So it's not just two. it's
Yeah.
more.
Yep, we could do that. We can clean that up.
We need to wrap up here. If there's any other questions or comments, can we just share them with you, Jen?
Yeah, absolutely.
Thank you.
Okay.
Nice work.
Yeah,
Know how to
way
find
to go. Thank you, Kaylee, so much for being here and giving us this background as well. And that is it for the policy meeting, Ben. Thank you.
Thank you.